A common disease that inflicts women is uterine myoma. In Western medicine, the treatment usually involves surgery, but removing the uterus has considerable after effects. The womb is a symbol of femininity and the source of human life. How then are the diseases related to the womb treated in Oriental medicine? Recently, both in the East and the West, there has been an increase in surgery to remove the uterus due to uterine myomas. 30% of women in the United States over the age of 60 and 60% of women in Europe of that same age group have had this type of surgery. But in Oriental medicine, there are methods of treatment without the use of surgery that can be used to preserve the uterus. Today, we will take a look at the Oriental medical methods of treating uterine myoma. To put it simply, uterine myoma refers to the fibroids that form in the uterus. Oriental medicine considers such growths to be caused by a cold and weak uterus and bad blood circulation, so toxins in the blood accumulate and coagulate to form these fibroids. For the diagnosis of uterine myoma, first, the physician checks the patient's pulse using a modern electric pulse machine. This machine enables the physician to observe the patient's pulse with his eyes and is thus convenient when comparing the condition of the patient before and after the treatment. Secondly, the infrared 경락 examination is carried out to observe the distribution of body heat. This machine helps observe the cold or hot parts in the body as well as chills in the hands and feet with an accuracy of 0.01 degrees Celsius. Like the pulse machine before, it is convenient when comparing the condition of the patient before and after the treatment. In addition, there is the CT examination. This medical machine is used to discover the kind of fibroid and its exact location. As the CT examination can reveal fibroids that remain hidden from ultrasound examinations, the two should be used side by side for an accurate diagnosis of uterine myoma.
In general, it is impossible to conceive or give birth to a child for a person with a myoma of about 5 centimeters. But through the use of Oriental medicine, a high percentage of cure has been shown. In March 1998, a 6.5 centimeter myoma with various symptoms of complication developed, but after 5 months, it shrank to 5.2 centimeters, and the other symptoms were reduced.
The main ingredients used in gamiongyongtang are cheongun and osuyu. These herbs have either hot or cold qualities.
I will prepare gamiongyongtang, which helps to strengthen the uterus. Osuyu, its nature is warm, and it helps to ease the pain by warming up the digestive organs and the pelvis. Cheongung helps to smooth blood circulation and relieves blocked hyols. Ginseng and licorice root and other medicines are added to prepare gamiongyongtang. For the temporary relief of excessive psychological stress, which leads to anger and depression, hagocho sogantang is prescribed.
The herbs mentioned here work by fundamentally removing the causes of uterine myoma. They are prescribed differently according to each patient's constitution and symptoms and become effective when brewed and taken on a regular basis. As just stated, the principal methods of treatment for uterine myoma in Oriental medicine is the herbal method. In order to increase the effectiveness of this herbal treatment, the following supplementary methods of treatment are carried out. Could you please show us these supplementary treatments? The intestines are connected to the uterus and vagina and so have a great influence on the health of the uterus. So, Oriental medicine makes use of enemas.
The medicine is drawn into the syringe, and a catheter tube is applied. The tube is then inserted 15 centimeters into the anus, and the medicine is slowly injected.
There are about 8 or 9 herbs in the herbal essence which is injected into the rectum, including toin and chunggun. Toin contracts the muscles in the uterus and expels toxins. Chunggung enhances blood circulation and helps regulate irregular menstrual periods. The patient is made to lie on her side, and in about 2 hours she'll be able to go to the toilet.
In this bottle, more than 10 different extracts of medicinal plants, such as geji and doin, are contained. Geji helps the uterus to contract and eliminates waste material and blood. Doin also helps with elimination and smooths menstruation.
A supplementary method in the treatment of uterine myoma is medicinal acupuncture. The herbs usually used are geji and doin. Geji contracts the uterus and removes the toxins in the blood. Doin also removes the toxins in the blood and regulates menstrual flow. So all in all, medicinal acupuncture is a method that helps blood circulation by resolving clotted blood, thus relieving pain in the abdomen. Puang therapy is useful in relieving menstrual cramps, and it can be carried out easily at home.
For the cupping treatment in uterine myoma therapy, it is applied along the side of the spine. Gansu helps to reduce stress and ease the tension in the uterus muscles, as well as strengthens the liver function. Charyo and Shinsu are connected to urinary organs. The cupping is essential to such areas for the relief of pain in the ovaries. To prevent uterine myoma, one needs to relax and eat properly during miscarriage, delivery, and menstruation. Regular exercise is also recommended for stress relief and comfortable excretion. Tight and poorly ventilated clothing are not recommended, and a patient with anemia should take enough protein.
If the uterus is surgically removed, it cannot be recovered. And after effects such as pain, stress, and even infertility may occur after surgery. So, does a woman who is afflicted with uterine myoma have to undergo surgery? The answer is no, because Oriental medicine has developed methods of treatment which can be used. We'll see you next time on Oriental Medical Digest.